So we've just finished the surgery with the CO2 laser treatment, and now we're doing the photobiomodulation therapy using the yellow light, which is called the cellular mode, which helps accelerate the healing process. Photobiomodulation, it affects the cells in a way, like the word says, it modulates that inflammatory process. So the whole process shortens and moves forward in a more accelerated fashion. And particularly, it aims at the chromophores in the mitochondria, and we have, over the past 20 or 30 years even, double-blind and triple-blind controlled studies. These are placebo-controlled studies that have shown the upregulation of vascular endothelial growth factor, which is the growth factor that's responsible for the growth of new blood vessels, which helps the healing process and the tissue perfusion. And as you know, oxygen flows through the blood to the cells and to the tissues, but also helps with accelerating the activity of the keratinocytes, which in this case I love in particular because we did a CO2 laser resurfacing and we want the skin to re-epithelialize more quickly, which is part of the healing process. Also increased collagen production by stimulating the fibroblasts, which accelerates the healing in deeper levels, which the surgery took place. And all of these three events together with aiming at the mitochondria, which elevates the ATP production, which is basically the currency. ATP is the currency for energy in the cell. And that upregulation with increased energy helps the cells to just function better and faster. And overall, it gives us a much better result and a shorter healing time.